Tom Smith arthritis. So it is a septic arthritis of hip in infants, that is in children less than 1 year. It is a fast progressing and destructive condition, and it can cause chondrolysis of the entire femoral head within a short span of time. So you know that in children the head of the femur is completely made up of cartilage. So it can cause chondrolysis of this cartilage, and that can result in destruction of the femoral head, and it will never recover. So such a child will have limping throughout the life. Coming to the clinical features, the symptoms include pain, inability to move, limp, fever, decreased food intake and irritability. Coming to the signs, the child will be severely toxic with high temperature and tachycardia. There can be joint line tenderness and fullness of Scarpa's triangle or femoral triangle. The joint will be in the position of maximum comfort, that is in the position of flexion, abduction and external rotation of the hip. There can be lengthening of the limb as there will be pus collection within the joint. So as the pus collects, there will be lengthening of that affected limb. There can be pain throughout the range of motion and severe pain on slightest movement. Coming to the investigations, blood investigations, count CSR, CRP will be raised. Serum procalcitonin, which is specific for bacterial infection, it will also be raised. On X-ray, early stage there will be no change, and late stage there can be destruction of the head. So it cannot be used to diagnose septic arthritis as there is no change in the early stage. So we'll be using ultrasound as an investigation. So the ultrasound can show the fluid collection inside the hip joint. So it can either be a serous fluid or a pus. So if it is pus, it is septic arthritis. MRI, it is the best imaging, but there is some practical difficulty of doing MRI in a child. Then hip aspiration. So first you will put a needle under the adductor longus in the direction of anterior superior iliac spine, and then you will be aspirating it. So if there is pus, it is diagnostic of the septic arthritis, and you will be sending the pus for culture and sensitivity. Treatment, it's an absolute surgical emergency and you have to do a surgery, and plus as it is an infection, you have to give antibiotics based on the culture and sensitivity report of the pus. So surgery, it is first you have to open the joint, that is arthrotomy, and then you have to wash the pus out of the joint, that is joint lavage, and then you will be closing the joint with a suction drain, and then you will start antibiotic. So broad spectrum antibiotics is usually used, and first IV and then oral. Pus, that is based on the pus culture and sensitivity report, and if that report comes, you have to change the appropriate antibiotics if there is no effect by giving that antibiotic. Now coming to the complications, there can be deformity and stiffness of the joints, pathological dislocation and osteoarthritis.